Good morning, I'm Jocelyn, pelvic floor physical therapist, and I wanted to come on to talk about using a framework to set up my patients' and my clients' expectations. So this live was inspired by my workout this morning, which was a 30-minute, as many reps as possible workout of 200-meter overhead barbell carry, snatch grip, 200-meter farmer's carry, holding a dumbbell, 35-pound dumbbell in one hand and a 35-pound kettlebell in the other hand, 200-meter retro carry in an overhead barbell snatch grip, so I'm walking backwards, 200-meter single arm dumbbell carry, and in farmer's carry, and then 200-meter overhead single arm dumbbell carry. And then every 6 minutes in that 30-minute bout of work, I would do 50 burpees. So essentially, the stimulus of the workout is conditioning. So when someone works with me and they want to get back to an activity, let's just say running, after having a baby, and they know that after their first or second baby, they had issues with leakage. Well, when I was a newer provider, I didn't have any framework that I would walk people through. So they would expect to get back to the thing so early or so quickly and feel great immediately. And that's just not how it works. You feel good quicker than the performance piece without the symptoms come on. So my framework is broken down into 3 phases. And I have this for everything that I rehab, regardless if it's for prolapse, or diastasis recti, urinary leakage, whatever. 3 phases. Phase 1 is the early phase. So depending on what they're seeing me for, that's what I have a different name. So if it's postpartum and they're just trying to get back to something without leakage, then it's the restore phase. Phase 2 is the revitalize phase. Phase 3 is a reach phase. Phase 1, so from phase 1 to phase 3, there's one big transformation. So you go from out of control of your body, not sure where to go, frustrated. At the end, you're at a performance level that you are well beyond you could ever even imagine, even better off than where you were before your first baby. But that doesn't happen in one plan of care. So plan of care is the one time or one bout of time where you're seeing me. That's typically like 4 weeks to anywhere from 6 to 12 weeks or more, depending on what you're seeing me for. So I meet that expectation, or I set that expectation from day one, and I break that down. So I'm like, okay, phase 1, 3 mini transformations. You go from uneducated to clueless to educated. You understand what the steps, who's going to be part of the team, what needs to be put in place, what we have to do with your intent and mindset, and what we have to do from a physical and a sexual healing or an awareness standpoint. Where you're starting at versus where you want to go, understanding those 2 different pieces. And then you have the transformation after that, where I call it the injured phase, symptomatic phase to asymptomatic phase, or not injured. And that's where the real rehab comes in. So we rehab your abdominals, you rehab your pelvic floor, we rehab your spine and your hips, and all the other pieces that are involved. So lots of hands-on work there, lots of tissue healing interventions. And then so you go from injured to not injured, asymptomatic to asymptomatic, just with basic tasks. Third transformation in phase 1 is then out of control of your body to in control of your body. This is where you start to learn your whole new body, because after having a kid or after having a surgery, you're different anatomically. There are things that are different, so you have to learn to adapt. And that's where we learn how to move differently and move in a variety of ways. So then we move on to revitalize. And these 3 transformations are all about creating tissue adaptation. So the first, they're not as in like linear. They blend really well together. I have deep core, outer core, dynamic core transformation. You go from poor, weak, non-functioning, poorly functioning core to a really well-functioning core. Then we go into, where is the next? Deep core, outer core. We have the mobility block, where you go from stiff to mobile. Mobility, not to get confused with flexibility, is your ability to control the full range of motion of a joint. So you have motor control. That's where, if I'm rehabbing someone for diastasis recti, that's where the abdominal, like the curling action, spinal flexion, spinal extension, moving through the full range of motion. Where people start is they're so stiff, they like hold their breath, they tighten everything up. And then once they're mobile, they're fluid, and they're able to move, they're able to breathe. So you go from stiff to mobile. Phase after that is the conditioning phase. It's the cardiorespiratory, the muscular endurance. So it's not only just the heart and lungs, but it's your ability to cycle reps in your muscles as well, in your legs, your arms, everywhere. So today's workout, if I was identifying what my intent was, if I was writing this for one of my clients, would be they've already gotten the deep core awareness step piece down. They know how to integrate it with the outer core. Now we're building conditioning onto that. So my intent there, notice it was every 6 minutes, 50 burpees. So most of the workout was performing burpees. I had about little less than 2 minutes at that to perform the carries after that first block. So my intent was to get people and myself to maintain good motion, full range of motion in the carries, but also stability, and be breathing in through my nose, out through my mouth as I performed all the movements. So that workout, the stimulus was specific to building capacity with the heart rate, my heart rate elevated. So that's a revitalized phase. Phase after that transformation, first phase transformation, the big one is you're no longer in the injured state. Your tissues are healed and they're ready to go. Phase 2, big transformation, is holy crap, your body is totally new and you have control over it. Now phase 3, the reach phase, is the overload phase. That's where we've already put in place the tissue adaptation principles in phase 1 and phase 2 in your abdominal wall, your pelvic floor, your stabilizers, everything. Now we build, we load it, we challenge it even further. It's where you are really pushing the weight. This is where we start to add some breath support. Like, you don't have to breathe through everything. Let's identify what the goal of the workout is and work out of that goal. So if it's a sprint, you're not going to be breathing normally like you would be in a 30-minute workout. We'd be pumping the weights, heavier weights or heavier resistance. You'd start to be integrating, if you're a runner, runs into these workouts. And then transformation is you're strong into stronger. Then the next block is you start to building volume in your running. Let's say if running is your goal, and we're building different type of runs and challenging you differently with terrain. So you're having to navigate unexpected obstacles, so your body has to respond and adapt. Last phase is, let's say if you want to be able to run like a half marathon or whatever, that would be you are not only racing, but you're PRing at that point. So the whole thing here is you're not working, that's not always just one plan of care, and that's not one time you're working with me. We work in blocks, and you understand every time you work with me where we are. And if we have to go back and hit different pieces or pull pieces, you understand what those pieces are coming from. So again, that popped into my mind after doing my workout this morning, which was a 30-minute, as many reps as I could, of 200 meter overhead barbell carry, 200 meter farmer's carry with a dumbbell and a kettlebell, 200 meter retro carry, so I'm walking backwards with the barbell overhead, 200 meter single arm dumbbell carry in a farmer's grip, 200 meter single arm carry in a overhead position. And then every 6 minutes in that 30-minute block, I had to perform 50 burpees. So at the end, whatever I had time left, which was typically 2 minutes, that's whenever I would go back to the carries wherever I left off. And the whole intent of that workout was conditioning. I knew I had to use my deep core. I was breathing, so I knew I was doing that. I had to use my outer core to help just propel forward. And then, of course, the burpees and just everything else jacked my heart rate up. So I had to cycle through it. So it was a whole about endurance. As you can see, I'm looking pretty gorgeous right now. It's already like almost 95 degrees in Arizona. I hope you have a great weekend. Stay safe. Don't lose your mind. I'm losing mine. I need to be around people other than Louie, but I'll see you later. Thank you for watching.